everybody. I'm most welcome to my YouTube channel. Today I bring to you a really brilliant topic that you're going to enjoy. And this I'm going to talk on yellow fever. So let's talk about yellow fever. So let's understand what's yellow fever and why some of the conditions that yellow fever are present and how can you identify the yellow fever. So when you're talking about yellow fever, this is a viral haemorrhagic disease transmitted by the mosquito, which is known as Aedes mosquito. So it's most common in the South America and also Sahara. That's most areas which is most common. But even in other countries, like tropical countries, it can be found. So let's dig much about it so that we have to understand how is it and what are some of the signs. So yellow fever is more far common like malaria, but the only difference is malaria is transmitted by the uh, Anopheles mosquito, while this one is transmitted by the uh, Aedes mosquito. So you understand the difference. So um, if we are looking at the signs and symptoms, they are almost the same. So if you let's look at the life cycle of it. So if the mosquito if the Aedes mosquito bites you whom you are not infected, it's going to get the plasmodium and go and bite another person. Then and that person, when is get bitten again, what happen is in the mouth of the in the mouth of the mosquito, the stages of the which we call gametes, from that point maybe has drawn the blood from one person. What is going to happen is, if maybe that mosquito is having the sporozoids that has just deposited for the first person first, then another mosquito which is not infected comes and by this person who is not having sporozoids is going to get that one and it go and bite another person. So during the gamete size, that's the stage whereby the ovule, there is a fertilization process that takes place to form the sporozoids. Once they have formed this sporozoid, then they deposit to the body of the person, and once they are deposited, they get transmitted to the liver via the merozoids. We call that stage as known as merozoids. So during merozoids, where they are going to be multiplying asexually to the point that they can move to the river where they can cause some damage there. Then they get back again to the bloodstream, whereby another mosquito comes in and bites a person. You understand? So and that mosquito is get the sporozoid which is infected, so it go and bite another person. So that's the life cycle rate. So now what happens is during the merozoids there will be also a lot of damage of red blood cells. Once the red blood cell they're getting damaged, because once it attacks the red blood cells, different red blood cells, they are going to burst. Once the plasmodium they multiply during incubation period in the red blood cell, they are going to burst, allowing them to attack other cells. You understand? So if a person is to break their life cycle, has to understand these principles. We have to know how to prevent the mosquito from getting to another person, right? So we're going to talk about it. So we have to understand to say that during this stage, that's where a person can present the signs of jaundice, because the red blood cell is going to be damaged, and the person now is going to present some signs of jaundice, yellowish of the skin, eyes, and all that. You understand? And it's going also to present some of the signs like headache. All of those signs they're coming in because this condition has attacked the red blood cell, and the supply of the oxygen to the blood, to the brain cells, there is raised, causing the brain to be at a pressure, because the brain cells, they need a lot of oxygen. They are oxygen consumer, so they need a lot of oxygen. So a person also can present some of the signs like vomiting, nausea. Sometimes can also present some muscle pains as well as fatigue, because the muscles will be the cells will be needing a lot of the oxygen. So if they don't have more oxygen, it means they are going to be affected. So it's really important that we have to understand this, so that we're able to trace it out. And once you present these signs, you have to immediately attend the health services, so that have to help you in right time. You don't have even to take some time to say, let me relax, let me do what. It's going to kill you. You know, it's very, very, very bad condition that if you can take a bit time, you are going to be at a risk. So some country they offer some of the vaccines. So for typhoid fever, and they also give you um, a notification card which represent to say that you have been vaccinated by for typhoid fever. So you get the yellow card, which is representing for, I mean, I'm saying, sorry, for typhoid fever it's yellow fever. So if which they will tell you to say, okay, if you are vaccinated by yellow fever, you get the yellow notification card, which is representing for the condition to say that you have been vaccinated. So the type of vaccine that they gave you is we call it is as stammer. So if they offer you that vaccine, it means you are protected from yellow fever. So if you go to the country like Sub-Sahara, South America, in those countries, you find that you are safe, you are protected because you have got a vaccine which is protecting you. So it's really important that you have to understand that, and you find that you are just living here. So once you understand that, you're going to protect your family, you're going to protect your friends and teach your friend to have the knowledge, so they have to know how to prevent it, so that it had not be transmitted from one person to another person. So let's look at some of the signs of let's look at some of the preventive measures that we can put in place. So we have also to use mosquito nets. It's really important because once you're sleeping under mosquito net, you're breaking its cycle from it to come and bite you. So it means you're safe there, right? And at the same time, we have also to wash away the stagnant water that is maybe within the drainage, the places where maybe this water can be staying, which it can be attracting the mosquitoes to be in such places. You understand? So it's really important. Sometimes we have also to use what you call doom. It's really important because it's going to it's an insecticide that we have to apply in the places where we feel like the mosquitoes they can start developing. So as well as we have also to make sure that the premises they are clean. We have also to clean these premises so that we don't attract the mosquitoes by cutting down the grasses, wrong grasses around the premises. For this is going to ensure that we have to maintain that personal hygiene so that we don't attract the mosquito to the places, so that we live happy, we build a better community. That's one of the things that we have to strive for. So I'm really glad, and don't forget to click the subscribe bell as well as notification bell to keep updated. I'm really happy. I'll see you next time. Thank you. Bye bye.